Welcome to Medigap TV, real answers about Medicare in plain English. Hi, I'm Loran Marms, and I've been a licensed Medicare specialist for 17 years working with clients in 46 states. If you are watching this video, there's a good chance you got a letter recently telling you that your Medicare supplement premium is going up and you're trying to figure out what to do about it. I want you to hear this right up front. You have options. A rate increase is not something you just have to accept. There are real paths forward depending on your health, your state, and your situation. And in this video, I'm going to walk you through every one of them. Let's start with why this is happening, because I think it helps to know you're not alone, and this isn't random. Medicare supplement rate increases in 2026 have been significant across the board. Plan G increases in early 2026 range from 12 to 26% depending on the carrier. And some major carriers like Mutual of Omaha raised rates over 20%. These increases are being driven by higher claims experience after the pandemic, and the trend is expected to continue. Here's what that means in plain English. The insurance company is raising your rates because their costs went up, and they're passing that along to you. That's how Medigap pricing works. But here's the part they don't advertise. You have options. And a rate increase is actually one of the best reasons to pick up the phone and call us. Before I walk you through your options, I want to say something important, because a lot of people get this wrong. When people get a rate increase notice, their first instinct is to either just go online and find the cheapest Plan G, or to call a few carriers directly and ask for quotes. And I understand that impulse, but it puts you at a real disadvantage. Here's why. When you call a carrier directly, they underwrite you on their terms, with their guidelines, with no one in your corner. If they decline you, that's information that can follow you to the next application. And the underwriting guidelines each carrier uses are not published anywhere. They are not on any website. The only way to know which carrier is most likely to approve your specific health situation is to have worked with those carriers for years and built that knowledge from experience. That's what 17 years looks like. We know which carriers are lenient on which conditions before we ever send in your application. You don't get that from a comparison website, and you don't get it by calling carriers yourself. So let's talk about your options, starting with the most straightforward one. Because Medicare supplement plans are standardized by the federal government, Plan G from Carrier A covers exactly the same things as Plan G from Carrier B. The coverage is identical. The only difference is the monthly premium and whether the carrier will approve you. That means if your current carrier raised your rate, there may be another carrier offering the exact same Plan G for significantly less money. The key is applying strategically. Getting declined at the wrong carrier first can affect how the next carrier looks at your application. That's why you want someone who knows the order, knows the guidelines, and knows where to start for your specific situation. You have options here, and we know how to use them. When you apply for a Medicare supplement outside your original 6-month open enrollment window, carriers can ask about your health history. This is called underwriting, and it's where a lot of people get confused or discouraged because the process is not transparent. Carriers ask about recent diagnoses, surgeries, hospitalizations, and current medications. Based on your answers, they can approve you at the standard rate, approve you at a higher rate, or decline your application entirely. And every carrier has different guidelines for how they evaluate each of these. The part that most people don't realize is that those guidelines are not public. No carrier publishes a list of what they will and won't accept. What we know after 17 years of working with these carriers is built from experience, not from any document you can look up online. A well-controlled condition like high blood pressure or stable diabetes often passes underwriting at many carriers, even when people assume it won't. The point is, you don't know until you know which carrier to ask, and that's what we're here to figure out with you. I want to be honest with you here because you deserve straight answers, not just optimism. There are conditions that commonly cause carriers to decline an application. Cancer, congestive heart failure, a recent stroke, COPD, and certain other serious or chronic conditions often result in denials during the underwriting process. I'm not going to pretend otherwise, but here's what I've seen over 17 years. The people who assume they can't qualify are often wrong. Carriers differ significantly in how they evaluate the same condition. One company's no is genuinely another company's yes. And if your condition is well controlled or has been in your history for a long time, there are often carriers who will look at that more favorably than others. So even if you're worried about what underwriting might turn up, please don't count yourself out before you've had a conversation with us. You may have more options than you think. And if it turns out that standard underwriting truly isn't available to you, there are still other paths forward, and we'll cover those in just a moment. If you are finding this helpful, hit the like button and subscribe so you never miss a video. This is an option that a lot of people don't think about, but it's worth considering if you're in good health and you rarely use your insurance. Plan G and Plan N cover the same core benefits. The main differences are two. First, Plan N charges a copay of up to $20 for office visits and $50 for emergency room visits that don't result in an admission. Second, Plan N does not cover what are called excess charges, which are the amounts a non-participating doctor can charge above the Medicare-approved rate. In practice, excess charges are rare in most parts of the country, and if you rarely see the doctor, the copays on Plan N are minimal. The premium savings can be real, often $40 to $80 a month less than Plan G depending on your age and location, and that adds up to $500 to nearly $1,000 a year. Switching from G to N requires underwriting just like switching carriers does, so the same guidance applies. You have options here, and we can help you figure out if Plan N makes sense for your specific situation. This is one of the most underused options in Medicare, and it's genuinely powerful if you live in the right state. As of 2026, 16 states have what's called a birthday rule or an anniversary rule. In these states, Medigap policyholders get a guaranteed window every year, usually around their birthday or their policy anniversary, during which they can switch to another carrier with the same or a lesser plan without any health questions at all. That means a person paying $220 a month for Plan G could switch to the same Plan G from a different carrier, charging $180 a month and save $480 a year, with no underwriting, no health questions, regardless of their health history. The important thing to know is that this is a moving target. New states keep adding birthday rules, and the details change. Indiana, Delaware, Virginia, and Wyoming all added birthday rule protections just in the past year or two. We track these changes so you don't have to. If you're not sure whether your state qualifies, that's a great reason to call us and find out. You may have an option you didn't know existed. If you've gone through the options above and underwriting is genuinely not available to you, there is one more path. And I want to be honest with you about both the upside and the downside. During the annual enrollment period, which runs from October 15th through December 7th every year, you can switch to a Medicare Advantage plan. Medicare Advantage plans do not use medical underwriting. They must accept you regardless of your health history, and coverage starts January 1st. For someone who truly cannot pass supplement underwriting and needs a lower monthly cost, Advantage is a real option, and I will never tell you otherwise. But here's what I want you to understand before you make that move. Switching from a supplement to Medicare Advantage means accepting a network, accepting prior authorization requirements, and taking on a different cost structure, including copays and an annual out-of-pocket maximum. And here's the part that matters most. If you switch to Advantage and later decide you want to go back to a supplement, you will need to pass underwriting in most states to do so. That switch can be very hard to reverse. So before you make any decision about Advantage during open enrollment, please call us first. We can help you understand whether it's the right move for your specific situation and what the long-term picture looks like. I want to take a moment and be direct with you about why the conversation you have with us is different from anything you can do on your own. When you call a carrier directly, you are talking to someone whose job is to underwrite you on that company's behalf. When you use a comparison website, you are seeing prices with no context about who will actually approve you. Neither of those conversations protects you. When you call us, you're getting 17 years of carrier specific knowledge about which companies are lenient on which conditions in which states right now. We represent you, not any insurance company. We are independent, which means our job is to find the best option for your situation, not to sell you a particular product. And because we work in 46 states, we know the birthday rules, the state-specific protections, and the local carrier options that vary from state to state. We track all of that so you don't have to figure it out on your own. The rate increase notice you got is not the end of the story. It's the beginning of a conversation, and we're ready to have it with you. Let me give you a clear action plan before you do anything else. First, call us for a free rate review. We will compare your current premium to what you could qualify for at other carriers based on your health and your state. That call costs you nothing and takes about 15 minutes, and you may find out you have a much better option available right now. Second, find out if your state has a birthday or anniversary rule. If it does, you may be able to switch carriers every year without any health questions at all, which changes everything about how you manage your supplement costs going forward. Third, don't wait for the next increase. Carriers can raise rates at any point during the year. There is no annual renewal window the way there is with Medicare Advantage. If your rate went up this year and you don't act, it can go up again next year. The sooner you review your options, the more you protect yourself. If your Medicare supplement rate just went up, you have options. That is the whole point of this video. You are not stuck and you do not have to just accept it. Call or text me directly at 920-545-4884. I'll give you a straight answer about what your options look like based on your specific situation. If staying with your current carrier, I'll tell you that too. If you'd like to book a free appointment instead, the link is in the description below. There's no sales pressure here. There never has been. 17 years of doing this right means I don't need to push anyone into anything. Thank you, and we'll see you in the next video.